नमस्कार. प्रुडंट मिडियाच्या हेल्थ मंत्रा ह्या कार्यावळीन तुमकां सगळ्यांक माये मोगाचो येवकार. तुमकां येवकार दितनाच हेल्थ मंत्रा हो जो हेल्थ मंत्र आमी तुमकां दिवपाक सोदता तो आमचो जो आज मंत्राचो जो उद्घोशक आसा तो आसा डॉक्टर मोहम्मद अफजल सिद्दीकी, गोंयचे नामनेचे लॅप्रोस्कोपिक एंड रोबोटिक गायनेकोलॉजिकल सर्जन. आणि खरोच विषय खूप इंटरेस्टिंग आसा, खूप कॉमन आसा, तितकोच तो रंजक माहितीपूर्ण आसतलो हाची आमकां पुराय माहिती आसा आणि पुराय विश्वासय आसा. Doctor, first of all, I welcome you to this health mantra.
Thank you.
Basically, health mantra is giving a lot of tips to the people and a lot of information also regarding different aspects of the medical field and medical disorders. So first of all, I think today it is better, and what you have chosen is a topic of fibroid. Fibroid म्हणजे जी गर्भाशयान गाठ जाता, अशें सादे भाशेन कोंकणीन जाका म्हणटात ते. आता ही गाठ कशी जाता, कित्याक जाता, केन्ना जाता, तेजेर कशा तरेन आमी जैत जोडू शकता, वेदर ऑपरेशन इज कंपल्सरी का ऑपरेशना शिवाय ताका कितें वेगळो मार्ग आसा, आणि हे पुराय विस्कटान माहिती करून दिवपा खातीर डॉक्टर सिद्दीकी आमचे बरोबर स्टुडियोन आसात. सो डॉक्टर, वन्स अगेन आय वेलकम यू.
Thank you.
सो वेन वी स्टार्ट विथ फायब्रॉइड, म्हाका दिसता लेट्स स्टार्ट विथ युट्रस. वॉट यू मीन बाय युट्रस, आणि मागीर वॉट यू मीन बाय फायब्रॉइड. फायब्रॉइड खंय जाता, कसो जाता, वेर इट अकर्स, वॉट आर द टायप्स, डिफरंट टायप्स ऑफ फायब्रॉइड.
So, first beginning with the question, what is a uterus?
Yeah.
Uterus म्हणजे कितें? Uterus means गर्भाशय, or पिशवी जी आमी म्हणटा.
बरोबर.
Okay, that is the organ which is there since birth,
Correct.
but it starts functioning when a lady starts her period, when a girl starts her period, when a पाय सुरू जाता.
बरोबर.
That is the organ थंयच्यान पाय येता, the uterus or the गर्भाशय or the पिशवी. And it works till the woman reaches her menopause, and after that it remains, but the function is not there.
बरोबर.
So, the uterus, the main primary function in the female is childbearing or having the child. That's the place burge jata, pregnancy jata. And this is where the commonest problem, one of the commonest problem affecting women, that is fibroids. There kami गाठ, पिशवीन गाठ जाला जी म्हणटा, that is fibroids, ती जाता. Now, this is an extremely common problem, causes a lot of difficulty to women because it happens in the prime of age.
बरोबर.
And it can cause some serious symptoms and sometimes even complications, unfortunately.
See.
So these fibroids are smooth muscle tumors. ते म्हळ्यार कितें, आमच्या शरिरान दोन भशेच्यो मसल्स आसता. एक voluntary muscles which we can move with our own decision, and one is involuntary or smooth muscles which we cannot move. They work by the control of the brain. It can be there in the intestines, in the lungs, or in the uterus. They are not within our control. Now, for some reason, these cells start multiplying and form tumors. Now, what does a tumor mean? A tumor means a mass which is not growing normally in a controlled way. This is not necessarily malignant or not cancerous. Let me give this point.
Absolutely.
Fibroids are non-cancerous tumors.
Absolutely.
Majority of the times. 99.9% of the times, to be very clear. But they are so common that they need some sort of investigation or treatment. They are predominantly of four types. In the uterus, they are divided upon the location. So the पिशवीन तीन layer असता. One is the endometrium or जी पायाची गादी म्हणटा मी, that. Then the muscle layer, and outside a thin covering called the peritoneum. And sometimes, so the fibroid which happens towards the endometrium is called submucosal fibroid. The पायाच्या गादीकडे जाता. Some in the muscle, predominantly muscle, that's intramural, and some भायल्या सायडीन जाता ताका आमी subserous म्हणटात. Very rarely fibroids can happen outside the uterus also, in the broad ligament, sometimes in the intestine, in the blood vessels, or in the lungs, but they are extremely rare. So, to tell you the point, fibroids are the most common benign tumors of the uterus, but means to the extent that in India about 30%, that is 3 out of 10 women have fibroids. But they may or may not know about it because depending upon the size. And 99.9% of those are non-malignant or non-cancerous.
ऍब्सोल्युटली. डॉक्टर, एक महत्वाचे स्टेटमेंट आसा आणि ह्याच खातीर रिपीट करता की ते सगळ्यांक कळचें म्हणून. ही फायब्रॉइड की जाका आमी पिशवेक जाल्ली गाठ म्हणटा, ती 99.99% म्हणजे कॅन्सरस, म्हणजे कॅन्सर जावपाची शक्यता आशिल्ली किंवा कॅन्सर आशिल्ली आसना. ही गाठ टोटली वेगळी आसता, जिचो नेचर वेगळो आसा. तेजे जशा डॉक्टरान आतां डिस्क्रायब केला की कशा पद्दतीची आसता, ती भितरले सायडीक आसा, भायले सायडीक आसा, काय ते वॉलान आसा, हाचेर ताचें भवितव्य किंवा ताचें नेचर ठरता. त्याचप्रमाणे अनेक त्यांनी जो सांगला ही इतकी कॉमन असा की ऑलमोस्ट 30% बायलांक हे असता, फक्त ते सगळ्यांक खबर असना किंवा त्याचे मॅनिफेस्टेशन जाल्ले असना. म्हणजे आम्ही सगळ्यांचो एक अल्ट्रासाउंड करून पळयना वन थिंग, किंवा ताका बाय पाळीचेर कितें प्रॉब्लेम आसा अशें जायना म्हणून ती अल्ट्रासाउंड करपाक वचना. हो एक दुसरो पॉयंट जालो. सो ज्या पद्दतीन ती मॅनिफेस्ट करता किंवा प्रेझेंटेशन करता, पेशंटाक ताचे जे कितें तक्रारी असता त्याचे वरसून आमी ते ठरयता की ही काडप की ना. बरोबर. डॉक्टर आता म्हाका सांगा की एकदा जे जालें की एकदा अशें समजुया की एखादे पेशंट, तुम्ही म्हटलें की 30% पेशंटाक ही कॉमन, म्हणजे बायलांक कॉमन आसा. आय एम नॉट इवन सेइंग पेशंट. देन वॉट आर युअर सायन्स अँड सिम्पटम, म्हणजे ह्या पेशंटाक जनरली कशें कळटा किंवा एखाद्या बायल मनशेक कशें कळटा की आपल्याक फायब्रॉइड आसा किंवा आपल्या पिशवेन गांठ आसा?
हय. मोस्ट ऑफ द टायम्स द वुमन they don't even know that they have a fibroid. ते वता हॉस्पिटलान हेल्थ चेकअप करपाक, नाल्यार पोटान दुखता म्हणून आनी कसले टेस्टाक गेले हॉस्पिटलान आनी अल्ट्रासाउंड केल्लो आसता कारण अपेंडिक्स जाला नाल्यार कितें गॉल स्टोन जाला आनी इन्सिडेंटली आमी पळयता की एक फायब्रॉइड आसा अल्ट्रासाउंड. मेजॉरिटी ऑफ द टायम्स दिस इज हाव इट इज डायग्नोज. पण समटायम्स वेन दीस फायब्रॉइड्स बिकम लार्ज, खूब व्हडले जाले नाल्यार खूब फायब्रॉइड आसा, समटायम्स दे कॅन बी मल्टिपल इन नंबर्स इन डिफरंट लोकेशन्स, देन दे कॅन गिव्ह प्रॉब्लेम्स ऑर दे कॅन गिव्ह सिम्पटम्स. The fibroid जे कॉमन सिम्पटम आसा, that is the commonest symptoms is heavy bleeding, heavy periods. So the periods can be they can be longer. Instead of 5 days, the woman will for 8 days, and during those 8 days, it will be more in amount. So she can pass clots, or she may be using up to 8 to 10 pads a day, which can lead to anemia. Sometimes fibroids can give pain. This pain can be there during the periods, or it can be there throughout the month. If the fibroid grows outside on the outer surface and grows towards the bladder, the woman may have urinary symptoms. मुतपाक त्रास जावंक शकता, परत मुतूंक जाता. If it is growing on the back side and goes towards the rectum, then you can have rectal pain, you can have difficulty in passing motions, sometimes you may have bloating and gas. If the fibroid is located in the cervix, which is tondar asa, nalar it is near the tubes, then it can cause infertility. And if fibroid is there and the pregnancy happens, very rarely it can cause complications in pregnancy like miscarriage or preterm labor. These are the common symptoms. Very rarely fibroids may form a polyp and may come out of the vagina. It may come out and be seen as a mass, or sometimes they become so big that they can press on the kidney and cause swelling in the kidney. They can cause constipation, or they can invade other organs if there is a rare form of a fibroid which can metastasize. But these are the most common symptoms, which is pain, heavy bleeding. Sometimes if it becomes large, you may feel a mass in the abdomen also. Pot मोठे जाता. These are the common symptoms.
बरोबर. म्हणजे परत हांव मातशें इन नटशेल सांगता की डॉक्टरान सांगलें की हे जे पेशंट असतात, म्हणजे ही जे बायल मनीस असतात त्यांचं चडशे फावटी म्हणजे तांकां कशें कळटा हो जो प्रश्न आशिल्लो, तर त्याच्या प्रश्नाचें उत्तर ताणें दितना सांगलें की खुबशे फावटी तांचो म्हयन्याची जी पाळी येता ती खूब दिसां खातीर जाता. एखादे मनशाचे बायल मनशाची समजा 3 ते 5 दीस असता जाल्यार त्या पेशंटाक त्या बायल मनशाची पाळी 7 ते 8 दीस आसूं शकता, 9 दीस आसूं शकता. एक क्वांटिटी म्हणजे खूप जाता तिका ब्लिडिंग, म्हणजे आंगार चड जाता सादे भाशेन सांगप जाल्यार ताका परत पॅड चेंज करचे पडूं शकता. तिसरे तेच्या आंगार क्लॉट म्हणजे कुडके पडटा अशें जे आमी म्हणटा सादे भाशेन ते जावं शकता. खूब ताका पोटान दुखूं शकता पाळीच्या वेळा, किंवा एकदां अशें आसूं शकता तो जर फायब्रॉइड तेजें लोकेशन जर फाटले सायडीक आसा, दुसऱ्या ऑर्गनाचेर जर तो प्रेस करता, म्हणजे तो शेजाऱ्याक त्रास करता जाल्यार तो शेजारी मागीर त्रास करपाक लागता, म्हणजे ताका संडासाक त्रास जावं शकता. जर ते फाटी रेक्टमाचेर आसा जाल्यार लघवेच्या वाटेक आसा जाल्यार लघवी परत जावं शकता, लघवेचे त्रास जावं शकता, किंवा ज्या लोकेशनार आसा त्या प्रमाणे त्रास जावं शकता. दुसरें म्हणजे केन्ना हो जर खूप मोठी गांठ आसा, मोठी जाल्या जाल्यार ते एक वेळ पोटान मारलो म्हणजे लागू शकता पेशंटाकूच, म्हणजे त्या बायल मनशेक पोटान कितें तरी आसा किंवा पोट मोठें जालां अशें दिसूं शकता. सो हे तरेकवार इन शॉर्ट जे हांवें सांगलें ते ताचें मॅनिफेस्टेशन किंवा प्रेझेंटेशन आसूं शकता. डॉक्टर एक महत्वाचो क्वेश्चन विच कॉमन म्हणजे चडशी बायलां सुद्दां आमकां विचारतात की आय एम टेकिंग गुड, म्हणजे आपण सगळे व्यवस्थित आपले सगळेच आसा, भुरगीं बाळां आसा, वॉट एव्हर, देन वॉट आर द कॉजीस, हे जावपाचें कारण कितें?
Yeah, this is a very good question, a very important question, and all patients ask this question. Unfortunately, the exact cause, my exact current, we don't know. But certain risk factors we know. Ki what these fibroids, in which type of patient these fibroids are common. So, if you see in African race, in the dark people, the fibroids are very common. 70%, like out of 10, 7 women have fibroids.
I see.
In Europeans, it's about 50%. In India, we see 30 to 50%.
So we are better off.
We are a little better off in that term, definitely.
Yeah.
So at about 30, we are seeing 30%. But as age increases, so increasing age, so when they reach around 40, 45, the perimenopausal age group, the incidence almost reaches 50%. So one in two women will have a fibroid. They may or may not know according to symptomology. So one is risk. The other is early menopause. So ladies who have early menopause, girls before 10 or before 12, we see a higher incidence of fibroids in them. women who have not had a child, either because of infertility or they have chosen not to have a child, we see a higher incidence of fibroids within them. And certain, what you call, medications. If there are women who are taking hormone replacement therapy for some reason, maybe post menopause or for some other reason, a little slightly increased incidence of fibroid in them. And in terms of diet, some studies have linked it to red meat. So people who consume a lot of mutton or beef or pork, I mean, not on a day, means not infrequently, who have a huge amount of that is a staple diet in that population, or people who have high amount of refined sugars. So where is ice creams, chocolates, where there's sweet sugar added and high alcohol content. These three diets are known to have slightly increased incidence of fibroid. So these are the risk factors. The exact cause is not known, but genetics in terms of the what you call our race. Yeah, one more important factor is family history. If your mother or mother's sisters or your own sister has had a fibroid, there is a 30% chance, 3 times higher risk of you having a fibroid. So these are the common risk factors of fibroid. The exact cause is still not known, sir.
बरोबर. म्हणजे डॉक्टरांनी सांगला की ह्याचे नक्की कारण हे कित्याक जाता हें आमी सांगूंक शकना, ताचे अशें नक्की हाचेर निदान जाल्लें ना की वॉट इज म्हणजे पिन पॉयंट करपा खातीर अमक्या खातीर जाता. पण डॉक्टर म्हणटा की चडशे जे इंडियन लोकांक आसा तांचे त्या मनान प्रमाण कमी आसा, कारण आफ्रिकन लोकांक चड आसा. तशेंच बाकीच्या देशांनी हाचें प्रमाण म्हणजे 50% आसा. आमी त्या मनान 30% इज लिटल बेटर. पण ताणें एक सांगलां की एखाद्या वेळार म्हणजे हाचें लिंक आसूं शकता, जे आमी समज चड प्रमाणात साखर, पेस्ट्री बी जशें कितें साखरेचे पदार्थ गोड खाता किंवा मीठ खाता, रेड मीठ म्हणजे मांस, मटण खाता, तातूंतय चडशे फावटी अशें दिसून आयलां. किंवा तुमचे थोडेशे लायफस्टायल आसा, हांचे कडेन असोसिएशन आसूं शकता. ताणें आनीक म्हत्वाचो मुद्दो हो सांगला की समजा तुमचे आईक किंवा तुमचे भयणीक आसा किंवा जाल्ले आसा किंवा तर हिस्ट्री आसा फॅमिलीन, जाल्यार ते जावपाचे चान्सीस प्रमाण चड आसता. डॉक्टर, नाव आय एम टेलिंग यू, वन पेशंट हॅज कम, लेट्स अस्यूम अ केस की पेशंट तुमचे कडेन आयला आनी तिणें सांगलें आपल्याक पाळीचा त्रास जाता अशें. सो नाव हाव यू कम टू कन्क्लुजन किंवा हाका फायब्रॉइडूच जाला किंवा आनी काय जाला, लायक सी आय एम जस्ट सेइंग फुडें हायपोथेटिकली दॅट कॅन बी DUB ऑल्सो, बट यू हॅव सेड कन्क्लुजन की हाका फायब्रॉइड जाला. सो वॉट इज दॅट डायग्नोसीस ऑर इन्व्हेस्टिगेटिव्ह प्रोसिजर विच हॅज गिवन यू definite opinion to come to the conclusion that this is fibroid?
Our first suspicion, आमकां पयलो doubt of the type of history. So if pain or menorrhagia, that is heavy bleeding or bleeding in between periods, these are the symptoms that we see in the particular age group, we suspect fibroid. But the best test to do as a first line test is an ultrasound test. That is the best test to diagnose in majority of the patients the location, the number and the size of the fibroids. If the woman is married or sexually active, then a transvaginal ultrasound is the best. I want to tell the audience that it's an ultrasound is sound based. It has no harm to you. You can do it n number of times. So transvaginal ultrasound in sexually active patients or married women, and if there are young or non-sexually active or people unmarried girls, then a transabdominal ultrasound on a full bladder is the primary test to diagnose. If the fibroids are very big or if there are complications, then you can confirm by doing an MRI, contrast or plain. What I mean by that is plain MRI karo, it is based on magnetic rays. Contrast mein ek injection deta, and with that we can do something called fibroid mapping. The exact number, the exact size, the location and their relation into the endometrial cavity can be precisely located on very large fibroids. Here I would stress to the audience that sometimes they think, why do we need to do an MRI when an ultrasound was done? For the simple reason that when there are very large fibroids, the shadowing effect may hide secondary fibroids which are behind the larger fibroid. And we may not be able to see complications of smaller fibroids. That's why if your fibroids are very large or if the doctor thinks there's some complication, he may advise an MRI. Then he can do fibroid mapping and know the exact number, location, size of these fibroids.
आता डॉक्टर आम्ही इन्व्हेस्टिगेशन जालें, कॉजीस जाले, आता एक सगळ्या बायलांच्या मनान किंवा बाकीचे जे पळयतात तांच्याय मनान हो प्रश्न आसतलो की वॉट इज अ मॅनेजमेंट, हाऊ यू गो अहेड विथ दिस टायप ऑफ फायब्रॉइड.
Yeah, well, this obviously it boils down to management for all as to what is to be done. The first thing I like to tell the viewers is that please don't panic. Today we know that the incidence or the chance of having the fibroid turning malignant is less than 1 in 1,000. That is 0.01%, less than that.
बरोबर.
In my 15 years of practice, I have seen one case. So please do not panic and do not let anybody tell you that if a fibroid is not removed, it will turn malignant. Please.
Absolutely.
I would like you to stress this point that you have to understand All fibroids don't need removal, all fibroids don't need treatment, and all fibroids don't turn malignant.
व्हेरी गुड. म्हाका असा हो महत्वाचो सामको महत्वाचो मुद्दो आसा. म्हाका दिसता सगळ्यांनी लक्ष दिवन आयकपाक जाय. डॉक्टरान सांगलें की आपल्या 15 वर्साच्या प्रॅक्टिसीन आपूण अशी एकूय केस पळोवना, म्हणजे एकूच केस पयली जी मॅलिग्नंट आशिल्ली. सो 99.99% हे जे फायब्रॉइड आसा, पिशवेची गांठ आसा, ती मॅलिग्नंट म्हणजे कॅन्सरस टर्न जायना, कॅन्सर जायना. कॅन्सर जावपाची कारण आनी कॅन्सर हो वेगळो प्रकार, ताचो हाचो संबंध थोडक्यान ना अशें आमी म्हणूं येता. एक गजाल. दुसरें म्हणजे समजा फायब्रॉइड आसा तो काडपाकूच जावो ना जाल्यार प्रॉब्लेम येतलो, हें अशेंच निदान करप किंवा अशें एक मनान एक भंय दवरप सामको चुकीचो. तिसरो म्हणजे फायब्रॉइड काडना, बेगीन काडना जाल्यार आनी कितें तरी जातलें अशेंय जायना. तर त्या सिच्युएशनान, त्या कंडिशनान पेशंट कसो प्रेझेंट करता, ताची लक्षणां, चिन्हां कशीं आसा हाचेर आमी डिसायड करपाक जाय वेदर दीस रिक्वायर्स रिमुवल ऑर नो. इट इज नॉट बाय म्हणजे फायब्रॉइड आसा ना फाल्यां कितें तरी जातलें, म्हणजे थोडे फावट अशें जाता डॉक्टर की पेशंट केन्ना इतको भिता की आय हॅव सीन फिमेल्स कमिंग क्रायींग की ना तर गाठ जाल्या आनी आतां कितें तरी जातलें, कॅन्सर जातलें, दे जस्ट गिव अप होप. तशें एकदम पॅनीक जावं नाका. दुसरें म्हणजे पॅनीक सिच्युएशन स्प्रेड करूं नाकात. खुबशे कितें करता, बायलां ती नळार गेली, बायलां एकमेकांक सांगता ना अगो ते हांगा जनाचें अशें जालें, मागीर तेच्या मागीर कॅन्सर जालें, मागीर तेजी भयण मेली. सो डोंट टायप म्हणजे अशा तरेच्यो गजाली स्प्रेड करूं नाकात. तुमी बेस्ट एडवायस तुमी ताका सांगपाक एखाद्या तज्ञ बायलांच्या दोतोराक मेळप. दॅट्स द बेस्ट थिंग. प्रिसायजली. कारण जेन्ना बायलांचो दोतोर तुमकां तपासतलो तेन्नाच तो निदान करूं शकतलो. बायल मनीस दोतोर अशें म्हणा, आय एम नॉट टॉकिंग अबाउट लेडी डॉक्टर, आय एम टॉकिंग अबाउट गायनेकॉलॉजिस्ट. बायलांची तज्ञ दोतोर, तो मेल आसूं किंवा फिमेल आसूं, दादलो आसूं वा बायल आसूं. डॉक्टर यू रियली म्हणजे दिस इज लायक आय ओपनर. म्हाका जर दिसता की आयच्या कार्यावळीचो जर सगळ्यात महत्वाचो मुद्दो आसा तो डॉक्टरान हो सांगला, आनी दिस इज व्हेरी इम्पॉर्टंट फॅक्टर. सगळ्यांनी मनान दवरपाक जावो आनी हो जो मेसेज आसा तुमी सगळ्यांक एकमेकांक सांगपाक जावो की तज्ञ दोतोराच्या डॉक्टरा कडेन वचप बायलांच्या, आनी सगळेच फायब्रॉइड काडपाचीच गरज आसता अशें न्हय. त्या सिच्युएशना प्रमाणे ते डिसायड करचें पडटा. डॉक्टर नाव आय एम टेकिंग जस्ट एकेडमिक ट्विस्ट. ओदो तुमी एक स्टेटमेंट केलें की केन्ना केन्ना हो फायब्रॉइड म्हणजे लिड्स टू इनफर्टिलिटी ऑर इज वन ऑफ द कॉज ऑफ इनफर्टिलिटी, किंवा ताका गर्भधारणा जावपाक किंवा जाल्लें उरपाक प्रॉब्लेम येवं शकता. सो केन्ना केन्ना अशी एक ट्रिकी सिच्युएशन जाता की आमी म्हणटा की काडलो जाल्यार तो कन्सेप्शन जावपाक प्रॉब्लेम येवं शकता. ते काडप काय ना हाचेर एक ट्रिकी बायस सिच्युएशन जावं शकता. इज डॉक्टर सो वॉट इज युअर टेक ऑन दिस?
See, my take is like any other good gynecologist take, that a fibroid can cause infertility only in specific conditions. All fibroids don't cause infertility. You have to understand that. So if the fibroid is in the cervix and पिशवीचे तोंड आसा, and it is a big fibroid blocking the cervix, that the sperm cannot reach the uterus, pregnancy will not happen. Or if the fibroid is blocking, it's near the cornu, म्हणजे fallopian tubes जे असता ते uterusan connect झालेलं असता, हेजे opening आसा आणि थंय fibroid आसा आणि ते block झाला, then it can cause infertility. Or if the fibroid is so large that it is distorting the endometrium, or it is projecting into the endometrium submucous fibroid, then it can cause infertility. These are the only types of fibroid which cause infertility. So if you have a fibroid which is growing towards the outside 4-5 centimeters, or which is not in the cervix, or which is intramural, not distorting the cavity, these fibroids don't cause infertility. The first point. Now coming to your point about operating or no, the principle is the uterus is a very sensitive organ. Each surgery leaves a scar on the uterus. The scar is a potential area of two things. One is weakness and one is adhesions. So whenever you operate on a uterus, you have to cut the uterus and remove the fibroid. There will be a scar which will be weakness for future pregnancy. And suppose the fibroid is deep or subendometrial, it can cause adhesions inside the uterus, which will itself cause infertility.
Correct.
So unless you have established that this fibroid is the cause of infertility, or it is so major that it will cause a sure shot complication in the next pregnancy, or most likely to cause a complication in pregnancy, do not operate. Most women with fibroids will conceive naturally, go and have uncomplicated pregnancy, deliver normally. So only if you are sure and the fibroid is of these 4 types, or it is impinging on the cavity, or the woman has not been able to conceive despite treatment, then you consider removal. So if intracervical fibroids, submucous fibroids, fibroid near the cornu, or very large fibroids distorting the cavity need removal. Otherwise, observe and let the woman conceive and get pregnant naturally.
बरोबर. म्हणजे हांव म्हणजे परत हें जर थोडक्यान सांगून अशें सांगप की हांव म्हणटलो की हे सगळे डॉक्टर इतले हें सांगला पळय ते म्हणून की हांव म्हणत की तुमी डॉक्टराचो सल्लो घेयात, दॅट द डॉक्टर डिसायड, आनी गुड गायनेकॉलॉजिस्ट वील एडवायज यू बाबा हो काडपाकूच जावो काय तो काडिनासतना तुमी प्रेग्नंट जावं शकता. कारण सगळेच फायब्रॉइड असा म्हणून तुम्ही प्रेग्नंट जायना अशें जायना इन नटशेल म्हणजे हा तो निष्कर्ष असो काडूं येता. डॉक्टर आता परत नाव अगेन आय एम गोइंग टू कॉमन मॅन्स क्वेश्चन, कॉमन मॅन्स क्वेरी म्हणटा तशी. आता तुम्ही डायग्नोज केलें, तुमचें निदान जालें, यू कम टू कन्क्लुजन. ना हाव यू गो हेड म्हणजे आता हो फायब्रॉइड मागीर समजा की हाका आतां मॅनेजमेंट. सो वॉट इज द मॅनेजमेंट ऑफ फायब्रॉइड?
Yeah.
नाव आता तुम्ही एक ऑलरेडी सांगला की सगळेच काडचे पडनात. So I will put in a little other way. Which are the fibroids you think of removal and what are the modalities of removal?
Well, the fibroids which are causing severe symptoms to a lady and which are not responding or not manageable by medical management. Today we have good medical management also. And if the medical management fails or the woman is not responding to the medical management, like she's having severe pain and she's young, you cannot give her painkillers every month for the rest of her life.
Correct.
Or she's having severe bleeding and it is not responding to medication. She keeps bleeding so much, तिका अनिमिया जाता.
बरोबर.
रगत परत become 6-7. केन्ना रगत दिवचे पडटा नाल्यार injection दिवचे पडटा. Every month you cannot do that. Or if the fibroid is causing symptoms like constipation or urinary symptoms, that is the time we decide to remove the fibroid. Now here one very important take home message I would like to give to the viewers, that you have to understand fibroid removal does not mean removal of the uterus. And if you are told that you need the removal for every kind of fibroid, please take it with a pinch of salt. You can conserve the uterus in most of the cases and only the fibroid can be removed.
Absolutely.
That is the most important message here, that many times you are told you are 45, you don't need your uterus.
Correct.
Remove your uterus. If there's a fibroid, remove your uterus. पिशवी काढूया आता काय काम नाही तुका बोरगी नाका न्ही पिशवी काढ. It is not right. Hysterectomy or पिशवी काढपाचे operation has its own complications and long term complications. So if you choose, you can still, even after menopause, if there is no risk of any other malignancy, you can still choose to remove the fibroid, which is called a myomectomy. A myomectomy can be removed in multiple ways. In the olden days, it was removed by open surgery.
Correct.
But today we remove it by minimally invasive surgery.
Absolutely.
So there are 3 ways of removing the fibroid by minimally invasive surgery. If it is submucous, जाल्यार पेशवीच्या भितरल्या सायडी म्हणजे पाळीचे जे गादी असतात थंय आसा जाल्यार hysteroscopy सकयल्यान from down like a DNC, a small camera is put and it is removed from down. No scars, no cuts, no problem. The other is minimally invasive, which is done from top. जेका आमी keyhole surgery नाल्यार laser surgery म्हणटा. It can be done by the surgeon directly, which is laparoscopy, or it can be done with robotic assistance, which is called robotic surgery.
सो आज ह्यो मॉडॅलिटीज सगळ्यो उपलब्ध आसात. डॉक्टर एक सगळ्यांच्या मनात एक प्रश्न आसतलो, म्हणजे तुम्ही आता ज्यो मॉडॅलिटीज सांगल्यो, सिन्स गोवा गव्हर्मेंट इज लिटल लिबरल आणि इट हॅज गिवन म्हणजे इट हॅज वायडन द हॉरायझन्स फॉर द ट्रिटमेंट अँड बेनिफीट ऑफ द बेनिफिशरीज ऑफ गोवा पॉप्युलेशन. हे हातून DDSYचे कितें बेनिफीट मेळूं शकता? कारण खुबशे फावटी जे हे प्रोसिजर आसा मातशे कॉस्टली असतात, म्हणजे टू बी लिटल फ्रँक.
Yes.
सो मनान खूप जाणां पेशंटाचे भंय असता की बाबा ना आपल्याक तो खूप म्हारग पडटले म्हणून. आणि व्हॉट हॅपन्स इन द बार्गेन, दे डोंट गो टू एनी डॉक्टर, म्हणजे नायदर दे गो हियर नॉर दे गो देअर. म्हणजे तांकां हांगा वचना थंय वचना, म्हणजे तांकां हें बरें दिसता अपिलिंग, बट दे फील इट इज गोइंग टू बी कॉस्टली. सो वेदर दीस प्रोसिजर्स आर कवर्ड अंडर DDSY is my
Yes,
simple question.
that's a good thing. I would like to tell you that myomectomy or removal of the fibroid is covered under DDSY scheme by the government of Goa, and you can choose to get it done at one of the centers. We at Manipal regularly do surgeries for myomectomy, laparoscopic myomectomy. Robotic is not covered, but laparoscopic myomectomy is covered, which is again minimally invasive and one of the best modalities for the patients.
बरोबर. डॉक्टरान सांगला की ह्यो काडपाच्यो खूप तरेकवार पद्दती आसात, त्या खातीर आख्खी पिशवी काडपाची गरज आसता अशें न्हय. ओन्ली इन सर्टन सिच्युएशन, बाबा अनअवॉइडेबल सर्कमस्टान्सीस ओन्ली वी हॅव टू रिमूव. बाकीच्या वेळार ती म्हणजे युट्रस म्हणजे गर्भपिशवी तशीच दवरून फक्त तो गाठ आसा ती काडपाची. जर ती भितरल्यान आसा जाल्यार हिस्ट्रोस्कोपी करून काडूं येता. वयले सायडीक आसा जाल्यार लॅप्रोस्कोपीक सर्जरी करून काडूं येता. ताचो फायदो अशें म्हणटा डॉक्टर की तातूंत तुमकां चड दीस हॉस्पिटलांत रावचें पडचें ना. यू कॅन बी बॅक टू युअर जॉब इमिजिएटली ऑर अर्लियस्ट, आनी चड त्रासूय जायना. आणि जशें सांगलां डॉक्टरान की हाची बरीचशी गोवा म्हणजे आमचे जे भलायकी संचालनालय आसा किंवा आमच्या भलायकी मंत्र्यांची इतकी व्यापक मोहीम आसा की हाचो बेनिफीट सर्वसामान्य मनीस एका प्रायव्हेट हॉस्पिटलांत वचून सुद्दां घेवं शकता. सो आय थिंक दीस इज ऑल्सो व्हेरी गुड दिस थिंग इनिशिएटिव्ह. डॉक्टर, नाव आय एम जस्ट आस्किंग व्हेरी इम्पॉर्टंट क्वेश्चन. Can this be, is there any modalities we can avoid getting fibroid? म्हणजे बाबा हातून आम्ही प्रिव्हेंट करू शकता जाल्यार what are those?
Well, we don't have any exact way or exact thing that we can say or do जे आम्ही करू शकता आणि म्हणटा फायब्रॉइड जावचो ना अशें काय ना. But there are certain ways which we can adopt in our life to reduce the risk. So one is a healthy lifestyle, so healthy diet. A diet which means if you're having a lot of red meat, so red meat's quantity is less. Some vegetables like broccoli or cauliflower or turnips are known to reduce the incidence. These soya and foods which have estrogenic effects, we should keep their amount a little low. These are known to reduce the risks. Exercise is known, or a healthy lifestyle is known to reduce the incidence. Pregnancy, so if you are married and if you complete your family means you have pregnancies, definitely known to reduce the risk. And if you are taking hormone, what you call replacement therapy, then taking it for the shortest period of duration is the best way to reduce the risks. So we don't have any direct method, but these indirect methods, reduction in alcohol, reduction of red meats, and healthy foods and healthy lifestyle with exercise is the best way to try and avoid the occurrence of fibroids. But more important than this, since we know their majority are asymptomatic, I would advise women, once they're planning or when they're planning to get pregnant, please meet your gynecologist before you get pregnant, so that they can screen your health, so that you can conceive in a healthy way. And secondly, once you're 40 and above 40, please go for annual health checkups, including a gynecological checkup where they will do your ultrasound and they would know if there is any major problem.
ॲब्सोल्युटली. मग असं डॉक्टरांनी तुमच्या मनातले सगळे प्रश्न आणि सगळ्यो शंका ह्या फायब्रॉइडच्या रिलेटेड सगळं दूर केल्ल्यो आसा. त्यांनी कारणां सांगली, कशा रितीन आमी प्रिव्हेंट करू शकता ते सांगले. डॉक्टर, ह्याच्या कडेन मुद्दाम तुम्ही वेळ काढून आयलो. यू आर सच अ बिझी पर्सन, तरी पण तुम्ही आयले आणि हेल्थ मंत्राचे आणि खरेंच तुमकां बरेचशे मंत्र ताणें दिले. आता ह्या मंत्रांचे आचरण तुम्ही तुमच्या दिसपट्ट्या जिणेन करचें आणि तुम्ही सगळ्यांक हेल्दी जीवन मेळचें अशी प्रार्थना करून आजची कार्यावळ सोंपयतना तुमकां सगळ्यांक मनाकाळजो संदेश बरें करूं. नमस्कार.